Hello, my dear students. Today is our first class on Department of Pathological Anatomy, and I'm glad to see you on my classes. The theme of first class is Introduced to Pathological Anatomy and Intracellular Degeneration or Parenchymatose Degeneration. My name is Dmitry Andreevich Mudrak, so my students may call me like Dmitry. My phone number you can see on this slide, and you may find me on WhatsApp for feedback. Necessary equipment for my classes. First of all, you will need two notebooks. The first notebook for lecture. It should be more than 48 pages. The second notebook should be 20 or 12 or 19 pages for control works. So in our department we will have microslides and we should draw it. For drawing you need album and colored pencils. On our department we have rating system. So we should talk about it. Our course includes two terms. In first term you will have 3 models, and in second term you will have 3 models too. Your rating for one model may be from 6 due to 10 points. So after 6 models you will have pre-exam test, and after pre-exam test you will have exam, 30 points. And maximum you will have 100 points. So talk about exam. In exam you will have 3 theoretical questions, each of them you will have 5 points mostly. For 1 examination slide, 1 examination case, and 1 organs with morphological manifestation of disease. About all of these steps we will talk in all of our classes. Actually, you may have automatically exam. For automatically exam you should pass your models in time. What I mean when I tell pass models in time. So for first semester you should get your third model, your third shot in day before New Year. For second semester you should talk 6th model before exam start. Marks on our department is traditional for our university. Less than 51 points and you will have a really big problem with our department and should again go to third course and start it again. But I hope it's not about my students. For marks 3 you should get more than 51 points. For mark 4 you should get more than 71 points. And for mark 5 or excellent you should got more than 86 points. So, and now we should start our theoretical part of our class. We should talk about pathological anatomy. We should understand what is pathological anatomy. Pathological anatomy is a science about morphological manifestation of disease. So every disease have morphological manifestation. Every disease change our organs, and in our department we will talk about which disease have manifestation on our organism, in our macroscopical manifestation in organism, and we should learn it by this year. Pathological anatomy have history. History of pathological anatomy have some periods. The first period is a period of autopsy. It's during from 17th and 61 It's called like organ pathology period or period of autopsy. Before this period, we have only long list manifestation about morphological changes in organs because of autopsy was banned. Second period is period of light microscope, and is this period called like period of cellular pathology. Next period is third period, is a period of ultrastructure pathology. And in nowadays we have period of immunopathology, molecular pathology, genetic pathology, and quantitative pathology. Pathological anatomy have two branches. The first branch is clinical pathological anatomy, and second branch is theoretical pathological anatomy. I will talk with you about theoretical part, but you should understand about something about clinical part of pathological anatomy. Objectives of clinical pathological anatomy is real-life diagnostic of disease. This is the most important part of work pathologists in clinic. Mostly pathologists in clinics do biopsy. After surgeon operation, you will put some materials and bring it to pathologist. And pathologist will see your material and get a right diagnosis. Second object is post-mortem diagnosis or autopsy. After death, all bodies, we should make autopsy and find out the reason of death this person. And it's actually a big work of pathologist in clinic. Third objective is professional development of doctors. This objective realized by autopsy. In autopsy, doctor with pathologist find out the reasons of death with patient, and doctor should complicate the reasons and clinical manifestation of disease, clinical and morphological manifestation, and it should help doctor in treatment of another patient. The fourth objective is preventive the spread of infectional disease. More often you may know that some patients die early without diagnosis. So pathologist will first doctor which can find out the diagnosis and find out the reason of death of this person. In cases when reason will be infectional, pathologists should accumulate all persons which contact with this patient and put them on isolation. Objective of theoretical pathological anatomy. So what we will talking about on my classes? We will talk about etiology, pathogenesis, morphology, morphogenesis, pathomorphism, complication, and outcomes of disease. So, few words about each of these objectives. Etiology. Etiology is the reason of disease, where disease come from. For example, for pneumonia, it should be mostly bacterial or virus pneumonia. Sometimes it may be pneumonia associated with thrombosis, embolism, and other reasons. So etiology will talking about etiology, about reason of disease. Pathogenesis. Pathogenesis is study about mechanism and development of disease. For example, we will talk about myocardial infarction. So pathogenesis of etiology of this disease will be thrombosis or atherosclerosis of coronary artery. Pathogenesis will be includes in that the piece of myocardial muscles have blood flow from only one artery, and blockage of this will determine to necrosis in this muscle and will lead to necrosis and will lead to infarction on this area of myocardial muscle. Morphology. We will talk about macroscopical and microscopical manifestation of disease. Return to our example with myocardial infarction. Morphology of these approaches will be in muscle of heart. We will see macroscopically. We will see area of white tissue. So this white tissue will be a necrotic change tissue of heart muscle. Normally a heart muscle will like pink or dark red structure. So we can find white strips on it, and we'll get right diagnosis with necrosis. Microscopically, we will see cells without nucleus. But cells without nucleus is the manifestation of necrotic process in cells, in tissues. So this is morphological manifestation of disease. Morphogenesis. Morphogenesis is talking about how disease change under different in different cases. For example, morphogenesis of myocardial infarction. If patient haven't any treatments, we will see necrotic process in heart, and if patient will still alive after myocardial infarction, we may see connective tissue in formation of connective tissue in heart muscle. So if we treat this patient, we can see non-change heart muscle. For example, it may be associated with thrombolysis in time of patient with myocardial infarction. Pathomorphism. How this disease may happens in another patient. Complication. Complication is science about complications of disease. For example, the most often complication for myocardial infarction is myocardial failure. The failure of myocardium will lead to brown duration of lungs, maybe, and other processes in patient's body. And outcomes or thanatogenesis. Outcomes in clinical departments, outcomes only two forms of outcomes. The first one, good one, patient healthy and he go home. And second one, patient die. In our department, we have some different way of outcomes. For example, for our myocardial infarction, the first of them may be die of patient. Yes, it's very bad outcome for this case. Good outcomes may be associated with formation connective tissue in place of in place of necrosis. It's first one. Second one, without myocardium failure. Second one, good outcome may be development of connective tissue with formation of heart failure, and it's not good, but better than death. Yes, and last one will be formation of connective tissue and die patient after some time after disease. There is more ways of development or outcomes of this disease. And thanatogenesis is a science about ways of death patient in each of disease. So next. Objective of examination in pathological anatomy. Objects in pathological anatomy may be bodies of deaf people, biopsy material, post-operative material, and experimental animals. The most often pathologists have deal with biopsy or post-operative material. These two parts of objects took more than 80% of the work of pathologists, and bodies of deaf people more than 20%. About 20% of work of pathologists. Experimental animals is about only for theoretical of pathologists. Methods of research is biopsy. What is biopsy? Biopsy is pre-live diagnostic manipulation which leads to pre-live diagnosis of disease. For example, you meet patient with some formation on his skin. So you, like a surgeon, took piece of this formation and put it to special solid and to bring it to pathologist. Pathologist find out under a microscope which is malignant tumor, and your course of treatment of this patient changed because you should remove big area of tissue. Autopsy. Autopsy is post-mortal or post-life method of research of body of patient. And scientific experiment, arrangement of animal model, disease and pathological processes. On our department, mostly we used mouses and rats for our scientific experiments. We modulated diseases of human in body of animals and tried to treat them and research morphological changes in different ways of treatment. The first block of our course is cell and tissue injury. The most important principle of Virchow theory development in base of every disease injury of cells. I should tell about Virchow theory and why it's most interested for us, like doctors in nowadays. Theory of Virchow will describe in 18th century. So Virchow was said that every disease, in base of every disease, is cell injury. So Virchow tell that cell is the most important morphological structure of our body, and in each of disease, in every disease, we can meet special different in morphology of cell. So in nowadays we our work based on this theory, and before of this theory we don't know about cells, we don't know about morphological manifestation of disease. We talk about pre-Virchow period. It was pre-science period. So there is more causes of cell injury. It may be hypoxia, genetic disorders, nutritional disorders, physical disorders, chemical disorders, biological one, the immunological one, and aging. But every cell for this injury may have two reactions. It may have reversible injury and it may have irreversible injury. Today we will talk about reversible injuries. It will be our talk will be about degeneration or dystrophies. But I talk right now that not all of degeneration are reversible. Some of them is irreversible and leads to necrosis and apoptosis. Irreversible changes in reversible reaction, we will talk about them later in our third or fourth class. In this slide you can see scheme of reaction of cell to injury. You can see normal cell, after that it took injury, and from this period it have two ways: the way to death and way to recovery. So if cell go to way of recovery, it becomes to normal cell. If it go to death way, it will go to necrosis way. About apoptosis we will talk later. Outcome of cell injury depended upon type of injury. If we talk about chemicals or biological injury, we mostly talk about irreversible injury. 70 of injury, duration of injury, type of cell, benign injured, some cell tissue sustained injury better with ours. Some tissues have ability to regenerate. For example, our brain cell, our cell of our brain, we have very big injury. We have big injured by hypoxia. Hypoxia leads to death of these cells most of all. For example, brain tissue can live without oxygen something about 5 or 7 minutes. If we talk about muscle tissues, for example, heart muscle without oxygen may live something about 15 minutes. It's 2 periods for brain. And some tissues may have good recovery. For example, liver cells. So, what is dystrophy or degeneration? Degeneration is a pathological process based on disorders of tissue or cellular metabolism and lead to structure changes. However, dystrophy is considered is one of the types of damage or alteration. I would like that you mark that dystrophy one of type of damage or one of type of alteration, because in second model we will talk about inflammation, and in inflammation we will talk about alteration. And you should understand that one of type of alteration is a dystrophy. This dystrophy is second definition of degeneration is dystrophy is a morphological manifestation of pathological process. Immediate cause of dystrophies. We have only three immediate causes of dystrophies or degeneration. The first one is disorders of auto-regulation of cell. For example, one cell have problems with nuclei or ribosomes, so it will lead to degeneration in this cell. The disruption of the functional of transport system. There are many transport systems in our organism. You know about blood, about lymph, about our breathing system. So every disruption in this system may lead to this degeneration, because they leads to chemical disorders or hypoxia or another disorders in our body. Disorders of the endocrine regulation. Neuroendocrine regulation, the very important part of regulation in our body, in for health of our organism. So every disorders in this neuroendocrine regulation will lead to dystrophies or degeneration. So for all degeneration, we have four mechanisms of the development of degeneration. The first of them is infiltration. Infiltration are associated with accumulated big counts of some substance in the cells. It may be liquids, it may be proteins, it may be glycogens or carbohydrates, and another part of product of metabolism. Decomposition associated with destroyer for very complex molecule due to some small molecules or small components. Abnormal synthesis associated with formation abnormal substance in our cells. It may be amyloidosis or alcohol hyaline. And abnormal synthesis may be associated with formation normal substances but in abnormal places. As you know, in our body we can have accumulation of glycogen in our liver. So if it in our liver and in our muscle, so if glycogen accumulated in our cells and in our organs, in our organism, it will be abnormal synthesis. For example, it may be in diabetes mellitus, in epithelium of our kidney. You can find glycogen in kidney's epithelium, and mechanism of development or mechanism of synthesis will be abnormal synthesis. And the last one is transformation. Transformation associated with disorders of synthesis by cell some products. For example, if cell formation glycoproteins, it may start to synthesis only lipids, only proteins, only in our products of metabolism, but but it will be one cell in this organism. Classification of dystrophy. We have some ways to classification. It may be classification by localization, by the kind of degenerate, by depending on the origin, and by depending on the prevalence of the process. So, by localization, we have parenchymatose or parenchymal degeneration, stromal vascular degeneration, and mixed one. By kind of derangement, we can see protein or dysproteinosis, fatty one or lipidosis, carbohydrates, and mineral type of degeneration. Depending on their origin, it may be acquired and hereditary. Depending on the prevalence of a process, it may be local and system 1. We should talk about parenchymatose dystrophies or parenchymatose degeneration. So, before we start, we should understand what is the parenchyma. Parenchyma is an accumulation of highly specialized cell connective with which have do the most important function of organ. So parenchymatose dystrophies is a structural changes in the functional highly specialized cells connected with derangement metabolism. It may be protein parenchymatose degeneration, fatty parenchymatose degeneration, and carbohydrate parenchymatose degeneration. Parenchymatose dysproteinosis may be 4 types. The first of them is cloudy degeneration, second one is hyaline degeneration, third one is hydropic or vacuolar degeneration, and keratinization. Let's talk about all of them. The first of them is cloudy degeneration or granular dystrophy. Actually, in nowadays, we don't talk about cloudy degeneration like a degeneration at all, because mostly we should talk about it like a compulsory process, because it associated with increase of functional activity of organ. It may be associated with alcohol in our liver and in our kidneys. It may be associated with a strong physical activity in our heart muscle and in our muscles in our body. But in our department, we will talk about cloudy degeneration like a type parenchymatose protein degeneration. Localization of this degeneration is hepatocytes, cardiomyocytes, and epithelium of tubes in the kidney. Causes of this derangement will be infection, intoxication, poor nutrition, disorders of blood circulation, and lymphokinesia. Pathogenesis, like I already tell, compulsory adaptation process. Macroscopically, organ pallid and dim swelling we can see on this organ. Microscopically, we can find out pink granules in the cytoplasm of cell. In electronic microscopy, you can find hypertrophy and hyperplasia of the mitochondria. And if them will ask you on exam with which causes, with which manifestation, with which morphological manifestation associated cloudy degeneration, you should tell them that cloudy degeneration associated with increase of counts and size of mitochondria in cells. Mostly outcomes is favorable. Sometimes it irreversible process if pathological agent, damage agent, will have a long duration, and if pathological factor have long duration, cloudy degeneration may lead to will lead to hyaline degeneration, hyaline-like. Microscopically, you can find accumulation of this red or pink granule in cells in organism. In this slide, scheme or draw or picture of epithelium of tubes of kidney. You can find pink granules in every cell of epithelium. Hyaline degeneration localized in same organs and in same cells, have same causes is infectional, intoxication and allergic reaction. Pathogenesis is decomposition, infiltration and prevent synthesis. Infiltration of proteins in cells, decomposition of microglobulins to hyaline, macroscope and prevalent synthesis will be associated with alcohol hyaline in liver. We will talk about some alcohol changed liver in second semester. So in second term, you will know about Mallory bodies. It's alcohol hyaline connective hepatocytes. Macroscopically, we couldn't find any changes in organs. Microscopically, hyaline-like pink drops in that cell's cytoplasm. For example, alcohol hyaline in next slide I will show you. Outcomes unfavorable. It's irreversible process which leads to coagulative necrosis. In this slide you can find these hyaline-like droplets, pink droplets in cells of liver. Hydropic degeneration. Hydropic degeneration associated with disbalance of salt balance in our organism. Localization may be in hepatocytes, cardiomyocytes, epithelium of skin, and convoluted tubes of the kidneys. Cells of adrenal cortex. Causes is infections, inflammatory reactions, influence of the physical and chemical substance. Pathogenesis is infiltration. Microscopically, most often you couldn't find any changes, but in skin you will find vesicles with fluids on the skin. You will see it in burned people. You may see it in herpes vesicles and in our disease. Microscopically, we can see big accumulation of vacuoles with fluids in the cell cytoplasm. Outcomes unfavorable, irreversible process which leads to calcification necrosis in the cell. In this slide we can see hydropic change in kidneys. So we talk about epithelium of tubes. You can find these empty spaces or light pink spaces in epithelial tubes. So these vesicles will be associated with hydropic changes. Mostly it may be associated with virus infections or or chemical disorders in kidneys. Keratinization. Keratinization is a special type of degeneration which may localize only in skin and mucous membranes. Causes of this derangement is infectional, inflammation, influence of the physical and chemical substance, avitaminosis, hereditary disease, for example, ichthyosis. Pathogenesis. Redundant degrades of synthesis of keratin. Macroscopically, you can find thickening and hardening of skin, while spots on mucous membranes. Important part of theory about keratinization will be about that in skin it have name hyperkeratosis, in mucous membrane it have name leukoplakia. And leukoplakia is the pre-cancer disease. You should have more attention for this patient with leukoplakia. Leukoplakia may meet in mucous membrane of cervix, mucous membrane of oral cavity, and in other mucous membrane. Most often it will be associated with genetic diseases. Microscopically, multiply trinket or only a layer of the skin or appearing of horny layer of mucous membrane. Outcome its recovery is possible after elimination of cause. In case of plakia, its appearance of cancer or pre-cancer disease. In this slide we can see hyperkeratosis. We can see that very big layer of keratin in this part of skin. Normally keratin take part for this border which I marked for you with red dot. You can find out that it's abnormal. So that's all about parenchymatose protein degeneration. We should talk about fatty degeneration. Fatty degeneration associated with increase of fat quantity or fats appear in place where are not found in normal state. Formation of unusual chemical composition of fats. The most important cause of fatty degeneration is hypoxia. You should remember it for all times for your exam. In exam, the most important difference between stromal vascular and parenchymatose fatty degeneration will be in causes. For parenchymatose fatty degeneration, the most important causes is hypoxia. For stromal vascular will be disbalance of eating, disbalance of nutrition. Several and protracted infections like diphtheria, tuberculosis, and sepsis, intoxications, avitaminosis, and inadequacy of nutrition. Less of all. Pathogenesis is decomposition. Macroscopically, you can find that all organs have yellow color and flatness. Microscopically, We can find fat in the cells and tissue, but typical microscopical reaction with hematoxylin eosine, we couldn't find out fatties because they disappear under alcohol injury. So for fats we have a special reaction, special color reaction with Sudan 4 and Charlach. Fats become a red color. Sudan 3 fats become in orange color. Sudan black and osmium acid in black color. I want that you should rewrite this part of slide and note it in every class. In every short I will ask you about special reaction. We will know about special reactions for different substances. The first of them will be special reaction for lipids. For lipids you should know four special reactions. Is Sudan 3, Sudan 4, osmium acid and Charlach. It's most often and most important special reaction for fats. I will ask about them on models. For hematose fatty degeneration characterized by impaired of metabolism of cytoplasmic fats. Morphological manifestation by the accumulation of droplets of neutral lipids in the cytoplasm of cell. For the detection of the lipids, Sudan 3 called frozen sections are used. With the usual methods of manufacture in histological preparation, vacuoles are visible in place of the dissolved fat droplets. Most often fatty dystrophy develops in liver, myocardium and fats. In our department and in your exam, most important liver and myocardium. I will tell about them right now. Fatty degeneration of liver, characterized by accumulation of neutral lipids in the liver cell hepatocytes. It's a consequence of the imbalance between internal utilization and removal of lipids by the liver cell. It's associated with following mechanism. First of them, excessive intake of fatty acid and triglyceride into the cell with hyperlipidemia. It may be associated with alcoholism, diabetes, general obesity. Second mechanism is diseases in the utilization, fatty acid oxidation on the mitochondrial crystals due to hypoxia, anemia and toxic effects. Third one is decrease in the removal of the lipids from the liver cell, which is mainly due to this decrease in the production of the apoproteins, which is necessary for the transport of lipids in the form of lipoproteins. In case of malnutrition due to a lack of protein in food or disease of the gastrointestinal tract, hypertrophic fatty liver, under the action of a toxic substance, ethanol, carbon tetrahydrochloride and another one. The fourth mechanism is hereditary defects of enzyme involved in fat metabolism. Fatty derangement of the liver have macroscopical and microscopical manifestation. Macroscopical manifestation: the liver is enlarged, have yellow color, flabby, and and it's all. Microscopically, in hematoxylin-eazine staining, we can find empty spaces in hepatocytes. If we have special staining, we could see typical for staining results. For example, for Sudan black or Sudan 4, we can find out black color staining in this cell and in our. The predominance of fatty dystrophy in the parental parts of the hepatic lobe indicate the infiltration mechanism of its development, which is characterized of hyperlipidemia. In the development of fatty dystrophy, mainly in the central segments of the lobes, is associated with the mechanism of decompensation and occurs with increased liver hypoxia. In this slide you can see macroscopical manifestation of fatty degeneration of liver. This liver have yellow color. In pathological anatomy we called it like goose liver. You can see it color. Microscopically, you can find this is hematoxylin-eazine staining, and you can find out that in hepatocytes you can find empty spaces without any substance. So, this is your first examination slide. The first examination slide is fatty degeneration of liver. You should draw this slide to your album and bring it to me up to our offline classes. I would like that we see in this term. In exam, we will ask you mostly, the first question will be associated with why this spaces is empty. You should talk that all fats will disappear by alcohol. And the second question will be associated with special stain for lipids in this slide. Fatty dystrophy of myocardium. Microscopical picture. Myocardium fatty degeneration often has a focal character. Fat containing cardiomyocytes are located predominantly along the venous knee of the capillaries and small veins, where the hypoxic factor is most pronounced. Mostly, these cardiomuscle cells will be localized under endothelium of endocardium of the heart muscle. Microscopical picture. Myocardium is flabby, pale yellow in color. The chambers of the heart are stretched. The size of the heart is somewhat enlarged. From the endocardium, especially in the region of the papillary muscles, yellow-white strips. So this heart have microscopical name by tiger heart is visible, which explained by the FODSI of the lesson. The quantity of the myocardium in fatty degeneration is reduced. In this slide you can see microscopical manifestation of this process, colored by Sudan 3. You can see accumulation of lipids in this part and in these parts of this tissue, in this heart muscle. Microscopically, it will look like tiger heart. You can find yellow and dark or blue strips in heart. In our offline classes, I will show you micro preparation of organ with tiger heart. Parenchematose, carbohydrate degeneration. Carbohydrates, which are determined in the cells and tissue and can be indefinite histochemically, are divided into polysaccharides, for example, is glycogen, glycosaminoglycans or mucopolysaccharides. It may be neutral and acid, and glycoproteins, mucins and mucoids. Histochemical methods of the revealing of the carbohydrates. It's for glycogen, glycosaminoglycans and glycoproteins, which should take a pass reaction. Some examinators will ask you about Schick reaction. Schick reaction is same process like a pass reaction. You should understand it and tell them that is pass reaction. Glycogen is dyed with carmine according to the best method in the red color. Glycosaminoglycans and glycoproteins are determined by means of metacargasia reaction with toluidine blue and methylene blue. The most important part of carbohydrate degeneration will meet in diabetes mellitus. Diabetes mellitus characterized by pathology of the B cell of pancreatic islands, which is leading to insufficient output of insulin. Insufficient utilization of glucose by the tissues, accumulation of it in blood, hyperglycemia, and excretion of glucose with urine, glucosuria. Tissue reverse of glycogen are decreasing distantly. Carbohydrate detergents connected with derangement of glycoprotein metabolism, accumulation of mucose and muconoid substances. Cause of this process is inflammation of mucous membranes, not only increase of mucose quantity but also change of mucose chemical contents. Mucose dystrophy underlies the disease. Mucoviscidosis, the most important in pediatric practice. Outcome: atrophy, sclerosis of mucous membranes, and most of all, its recovery is possible. So, that's all theoretical part of our today's classes. For practical, you should first one draw examination slide with fatty degeneration of liver, and your second task is cases for this class, which you can find on portal. You can find them in link under this video on YouTube. So thank you for your attention, and I hope we will meet in our offline classes. I will wait for your cases on